Do you feel pain in your lower back, buttocks, thighs, or legs? You may also have lumbar spondylolisthesis. Several months ago, I started to manifest deep muscle pain in my buttocks and thighs, especially upon waking up in the morning. I couldn't stand up right away because of the pain, so I would sit down for a while before standing up and starting to walk slowly. I would even sit on a chair while taking a bath because I couldn't stay standing for a long time. I thought it was a menopausal symptom or just because of my sedentary lifestyle, so I took calcium and vitamin B complex supplements. I also had urinalysis, uric acid, and creatinine tests, but the results were normal. For severe pain, I just took a pain reliever, celecoxib. I even thought it was piriformis syndrome, a condition in which the muscles in the buttocks spasm resulting to pain. So I tried various stretches and exercises on YouTube, but the pain was not relieved. At the start, the pain decreased when sitting down, but eventually the pain persisted even when sitting. It was difficult for me to stand up even for a short time, and it was a struggle for me to climb up the stairs. My daily activities were really affected by the pain. I only decided to consult a spine doctor when I noticed a bulging or swelling in my lower back. Right away, he ordered an X-ray of the lumbosacral spine, APL, flexion, and extension. Upon viewing the X-ray images, his impression was lumbar stenosis L4, L5 secondary to dynamic spondylolisthesis. What is this lumbar spondylolisthesis? In lumbar spondylolisthesis, the vertebrae are not aligned properly. Now let us take a look at the normal anatomic landmarks to have a better idea of what we are looking for. The vertebral bodies are highlighted here in red. The thecal sac enclosing the spinal cord is in green. You can see the vertebrae are lined up perfectly with no shifting whatsoever. Let us see the abnormal spine. Can you spot the differences? Here are the vertebral bodies. The thecal sac is in green. Now let us take a look at the position of the back of the vertebral bodies in yellow line. Can you see the difference? That's right, it is highlighted here in blue. You can see that the back of these bones are all lined up perfectly here until it gets to this bone and it shifted forward. And this bone here, which is the L4 in relation to this bone L5. This causes bulging here and pinching the thecal sac in this area, causing the symptoms. What does it cause? There is back pain because of the grinding of those two bones that are abnormally moving. Another is stenosis or narrowing of the spinal canal, causing discomforts to the buttocks and hamstrings as well as to your calf and feet. The discomfort is worsened while standing and walking and is improved while sitting down or laying down or leaning forward on something such as push cart when you are in the grocery store. So I was advised for spine surgery called posterior decompression and instrumental posterolateral stabilization fusion. In the meantime, I was ordered gabapentin, celecoxib, and mecobalamin. To have the surgery in a private hospital, I had to prepare 450,000 pesos, inclusive of the implants, doctor's fees, and hospital fees. The implant package itself already cost 220,000 pesos. So, for practical reasons, I opted to go to a public hospital for treatment. And I underwent MRI for a detailed diagnosis of my condition.